presence is instantaneous. It doesn't take more time to be present. It takes a different quality of mind. My job as a doctor is not just to use time wisely, but also to make time happen. I realized that my ability to be present and be attentive in the face of suffering was the most important skill that I could bring.
I want to read something from your book. You say fearlessness is required to look at our failures in the eye.
We are constantly, in a very physical, psychological, and maybe spiritual way, of experiencing wounds and repairing them. The ability to cultivate and to appreciate beauty wherever it resides is just who we are as humans.
So how do you balance that as an expert? How do we meet suffering with compassion without getting lost in it? I just want to quickly thank you for beginning to watch this podcast episode. If you haven't subscribed yet, feel free to do so. Would love it if you join our community. You'll also be up to date on the latest content, and this really helps me reach out to more guests. You can also visit our website, centerformindfulness.ca. There's free events about mindfulness and laughter. Hope you enjoy this episode. Hello, everyone, and welcome to this episode. I'm truly thrilled to have a conversation with Dr. Ron Epstein. He's an internationally recognized physician, educator, researcher, and writer. He has over 300 scholarly articles and his truly masterful book, Attending: Medicine, Mindfulness and Humanity. It shows how health professionals can flourish, building strong connections with patients and colleagues, optimize the care they provide, and become more resilient. This episode is not just for healthcare providers, but anyone interested in what it means to be human, to be learning how to thrive amid suffering and flourishing with life's challenges. So a warm welcome to you, Dr. Epstein.
Well, thank you. Thank you. It's really a pleasure being here with you.
Thank you so much for joining us. And for those of you who are not as familiar with your work, I'll just share a little more about your truly deep work over decades. So Dr. Epstein co-directs the Center for Communication and Disparities Research and Mindful Practice in Medicine programs at University of Rochester School of Medicine and Dentistry, where he's a professor of family medicine, oncology, and medicine, so palliative care. I'll also put the link in the show notes. You have so many fellowships and recognitions that I just really want to make sure the audience, the listener, know your deep work that you've done in this beautiful work in medicine. So I wonder if we can begin with what led you to this path of flourishing in medicine, interest in mindfulness, and healing and resilience. Like, what are the early fruits that pulled you into this?
Yeah, so this started long before my medical training. So, and probably, like everything, had some roots in one's childhood. I was asthmatic as a child, and there weren't very good treatments for asthma. And so I became, by necessity, quite aware of the breath, and especially when I couldn't catch my breath, and discovered that just by being aware of my breathing, actually I could regulate my breathing, and in that sense, experience some greater comfort in the symptoms that I had. So that's starting when I was 8 years old. And then in the 1970s, discovered meditation. It was really the whole Maharishi movement in the late 60s and early 70s, and then interest in Zen Buddhism. At university, studied music and also Buddhist philosophy, and ended up spending some time at the San Francisco Zen Center. It's now 50 years ago when I was 19. I actually thought that I might spend the rest of my life there, and for a variety of reasons chose not to. But nonetheless, that brief time had a very powerful and enduring impact. And so I've had a meditation practice since then. So for the past 50 years, every morning, I do some sitting and continue to do that. So for me, it's always been part of my life. And my interest in medicine, I was interested in being a doctor when I was a kid, but it kind of reawakened after I had a meditation practice and really began thinking about suffering in a very philosophical and pragmatic way. And it was through that route that I thought, well, if I'm interested in suffering and healing, I should go to medical school.
Hmm.
Um, and I know it's a little naive at the time because I didn't quite know what I was getting myself into. But when do we ever?
Right.
And
Until we
right,
begin.
right. So and there encountered environments that were both extremely hostile and also extremely welcoming. So I ended up at Harvard Medical School, where Herbert Benson was doing his early research on the effect of meditation on cardiovascular health. And through that, through his work and through his group, met some very interesting people who were trying to bridge the contemplative practices with healing practices, both Western and non-Western. And through that, I met John Kabat-Zinn in 1980, just as he was getting his stress reduction clinic started. But those two worlds of becoming a doctor on the one hand and engaging in contemplative practices were somewhat separated until I had some close friends in medical school who were also meditators, but there weren't many people, and it didn't really go public about
Like
it was kind of part of my,
closet meditator, right? Like it's just
yeah,
here on the
well,
side. Yeah,
right, right.
yeah.
So it wasn't quite that extreme, but it was part of my personal life and not part of my professional development so much, or so I thought.
Yeah.
Um, but then when I started encountering patients, especially those with incurable illnesses and serious illnesses, and towards the end of life, I realized that my ability to be present and be attentive in the face of suffering was the most important skill that I could bring.
Mm.
Learning diagnosis and treatment and medications and all of that seemed to me to be the easy part, and the hard part was making this human connection with someone who might be very different from me, who was suffering in any number of ways.
Mm.
When I started my residency, just by coincidence, I inherited a cohort of patients with HIV disease and AIDS. This
Mm.
was 1984, before there were any effective treatments.
So this is at the
Uh,
height of the.
exactly,
Yeah.
exactly.
Wow.
So again, the issues of encountering suffering of people who were young, who
Mm.
would have otherwise been healthy and vibrant, witnessing the ends of their lives, which sometimes was not very pretty,
Yeah.
was another thing that kind of brought me closer to this connection between contemplative practice and medical practice.
Mm.
And then I ended up doing my residency in Rochester, New York, where I still am, which was a very fertile environment, largely due to what's called the biopsychosocial model, which kind of
Hmm.
originated here, and was also a strong influence.
When you say here, I mean Rochester.
In Rochester, New
Yeah.
York, yeah,
Yeah. Yeah.
yeah. And so the things that I kind of had kept as part of my private life increasingly became part of my identity as a physician. To the point that I realized that there was something really missing in my medical training and also the training of my colleagues, which had to do with attention to the self of the practitioner. Who is this person who is a healer? How well do we know ourselves? And the degree to which we know ourselves, can that actually help us do the work that we're setting out to do? That is, managing and healing and encountering suffering. So I
Mhm.
started to write. And kind of as a personal manifesto, I wrote an article 1998, 1999, which ultimately got published in the Journal of the American Medical Association. It landed on the desk of a very sympathetic editor who was very helpful, a
Mhm.
woman named Charlene Breedlove, to whom I'm eternally indebted. And she understood what I was getting at.
Mm.
And we worked together on the article until it was published. And then I received like a tidal wave of correspondence
Mm.
from medical professionals saying, yes, this is missing, was missing in my training too. This is really important. And this needs to be part of medical education and medical practice. And for me, that was a total life-changing experience, to
Mm.
be validated that way. And people started asking, well, what would you do to train doctors differently,
Yes.
to be able to engage with patients in a more mindful way. So my first answer was, well, go live at a Zen center for a while, meditate for 8 years, and
Ben.
then maybe you'll have a clue as to what to do. It's like, and I mean, it would be really nice if that was part of a prerequisite for medical training, but I
Yes,
suspect we
I agree.
we wouldn't find a lot of people applying to medical school. So we had to, I say we because now I was finding other soulmates in this pursuit,
Mm,
started wondering, like, how are we going to do this? How are we going to make this happen? And by what means?
mm,
And at what point in medical training? And how do we help people sustain a practice and continue to grow throughout their careers? So these were like big questions and by that time I held a position at the university here as being responsible for some aspects of the medical school curriculum and talking with colleagues, some of whom were sympathetic and some of whom were, for lack of a better word, living in the past. Um, uh, just trying to forge a road ahead, wrote a number of grants to develop programs and
mm.
for medical students, residents, practicing physicians, academics, researchers, and then met up with Nick Krasner, who you've had him on
Yes,
your
yes, he's been
podcast, I
on the
believe. Yeah,
episode, so I'll
yeah,
put the link to that
right.
episode as well.
Yeah, so who had a very different trajectory. He had done MBSR training and was doing MBSR groups
Yes.
with patients, with
This is
health
mindfulness-based
professionals.
stress reduction for those who don't know.
Yes, yes,
Mindfulness-based
yes.
stress
Thank you.
reduction. Yes.
Yeah. So that's the program that was started by John Kabat-Zinn in the 1980s, mostly for patients who were
Yeah.
experiencing chronic pain and other debilitating conditions.
Yeah.
So then we developed a year-long program for local primary care physicians, wrote it up, again, published it in JAMA, the Journal of the American Medical Association, with a lot of attention. And then people said, well, I live in Australia, what can I do? And then we started running programs, shorter programs, intensive workshops that people could
Mm,
come here for several days and become part of our community and learn some contemplative and other skills to build self-awareness and presence and attentiveness that they can then bring back with them to their work settings and hopefully help them be happier, more effective, more sustainable
mm.
in the work that they did.
I have so many curiosities about this really profound work that you have, and thank you for sharing that background and so clear. Like it's infused in who you are. It's not something you just do. Like the misconception sometimes you meditate, just take a bit of time. It's a task. You do it. It's over. But actually, it's a way of being with ourselves. It's about being with others, and so many things struck me about your work and your book. And I just want to go back to something you just shared, how it's not just information as a physician or healthcare provider. It's not just providing solution to and fixing pain, but actually it's meeting suffering in others and within ourselves, because we're affected as humans. But somehow there's some dehumanization that intentionally or unintentionally happens in taking care of others. So I'm wondering if you say a little about that. Like if we can just begin with even what is attending?
Well, the title of the book is kind of has a threefold meaning because
Mm,
when you're the doctor in charge in the hospital, they call you an attending physician,
mhm,
right? Attending has a connotation of paying attention to, and
mm,
there are many different ways in which we can hone our attention,
mm,
focused attention, more open attention. And also its roots it comes from the same root as to wait or to wait on or to
mm.
serve. And so it implies patience, PATIENCE,
Mhm.
as well as
Yes,
patients, the
that's
people who come
right.
to doctors, right? And presence. So to really be an attending physician really involves a set of responsibilities to the patient you have and to society. It involves cultivating a kind of presence that has a non-specific healing effect.
Mm.
and helps win trust. And also, it goes both ways. When I'm feeling more present with a patient, I feel more alive. I feel more connected to the work that
Mm.
I'm doing. And then this capacity of witnessing, of taking in what's offered in
Mm.
terms of information uh, and another person's experience,
Mm.
and holding that with in a respectful and compassionate way.
Mm.
So the word attending for me carries all of those meanings.
So much. Because it's about, as you're describing it, it's not just being with the disease that's within the person, whatever it is, if it's physical or illness or emotional illness, psychological. It's not being with the problem, but actually being with the person who's experiencing the problem and how they might be feeling in what's happening for them. And that really struck me because I've felt it when I've been attended, I've experienced it on the receiving end as a patient, and when I haven't, it feels so minimized, so like far away. And here's this physician who's like on a pedestal, and I'm very at the bottom. And when I'm attended, it's a whole different experience of like, wow, I'm heard.
I'm just curious, I'll ask you a question.
Yes.
How quickly does it, when you like meet a new doctor or something, how soon do you know if that doctor is really attending to you? How long does it take?
I would say it's pretty quick. Because
Yeah.
as soon as get in, like, is the doctor even looking at me or just like typing away or looking at a chart and like already I can feel this like let's go vibe. Let's go.
Right. So one of the messages is that presence is instantaneous.
Mhm.
It doesn't take it doesn't take more time to be present. It takes a different quality of mind.
Mm.
So, I mean,
Um,
the flip side of all of this is that we have a lot of work to do. I mean, a doctor's day is quite pressured
yeah.
time-wise in terms of elapsed time, right? In terms of what the clock says. But
Mm.
there are ways of making time. For example, if you're feeling attended to, if a doctor's sitting down, looking you in the eye, and really listening and taking in what's important to you, you feel that more time is that the doctor's actually spent more time with you
Mm.
than if the doctor seems rushed or distracted in some way. And colleagues of mine have done research on this, have done research on whether if a doctor sits down or stands up or uses different kinds of communication strategies, and they ask patients to estimate the time spent. And the time is always longer when there are these markers of presence.
Oh,
And
amazing.
yeah, so part of my job as a doctor is not just to use time wisely, but also to make time happen.
Mm.
And it sounds a little mystical, but in fact, I think it's a kind of a basic psychological response to feeling heard, understood, attended to, and in someone else's
Mm.
authentic presence.
This feels a change of perception and perspective on your part. So as a physician, internally something might be changing as well. Seeing the patient differently, I would imagine, creates a little different sense of time even for you.
Yeah, it does. It does. I mean, clocks are helpful sometimes
They
because you can lose
yeah.
track of time, right? So, but it does. But I think also that kind of engagement is involves taking a risk.
Mm.
That it involves letting go of some of your of control over what happens in that visit and putting some of that control in the patient's hands. And it also involves, if you really listen to patients' answers, people are experiencing extraordinary kinds of distress,
Yeah.
and you cannot help but resonate with that.
Mm.
So, one of the aspects of contemplative practice is the ability to metabolize that kind of distress without falling to pieces.
Mm.
And so, the reaction that physicians might have of distancing themselves and feeling removed, in a way, is an understandable self-protective mechanism. If you and I feel that myself also. When I have a patient who I've known for a decade, who has some horrible illness and is dying, I can't live with that reality 24 hours a day. I mean, I need to create some boundaries, some way to maintain my own sense of balance,
Mm,
which I think is perfectly okay as long as that's what you know you're doing. And
mm,
if you can step inside and out of that role. And there are also mechanical things that we have to do as doctors that are uncomfortable or require incredibly focused attention. I
mm,
have a colleague who's a neurosurgeon, a brain surgeon, and when he's in the operating room, he describes that the world contracts into this very, very small little window that he's looking into in someone's brain. Now, clearly, he knows this is a person who has a life and a family and an occupation and all of those things, but he has to set that awareness aside to really
mm,
focus on this very fine task. So that kind of laser-like focused attention is incredibly important, but also this more holistic, open attention to whatever happens to be occurring is also important. So this regulation of attention goes both ways.
and that's something cultivated in mindfulness, this sense of
Uh,
attention,
mm,
one of the
yeah,
qualities of like knowing
yeah.
flexibility of attention, zooming in, zooming out. I want to ask you a couple of things about that and compassion, but I want to just read something, and I'm not sure if you're referring to the same surgeon, but there's a quote that I want to read from the book that I really appreciated. You were describing a masterful surgeon who was dealing in a moment with a blood vessel that was leaking in the middle of surgery, and witnessing the surgeon. I'm just going to read this quote because it's just so beautifully written. He said he shifted seamlessly from autopilot to a more deliberate, choreographed action. First tango, then ballet, then a few minutes later back to tango, all without missing a beat. No panic, only calm focus, surgical mindfulness in action. So beautifully described. Surgical mindfulness in action. So is that what makes a difference between masterful and kind of okay surgeon? There's this something.
Well, yeah, I mean, I think so. And I have a surgical colleague in Toronto who actually studies how surgeons act in the operating room and finds that surgeons who can actually enter and leave autopilot and slow down when they should are really, that's really one marker of expertise. Now,
Mm,
how do they learn to do this? Because this particular surgeon I talked about in the book probably had never meditated in a day in his life, was a
mm,
very extroverted, uh, funny, kind of laughing, joking kind of guy, did not strike you as a Zen master kind of person. Um, but boy, during that moment that I witnessed, and he was a vascular surgeon, it was an abdominal surgery. Uh, when I witnessed that moment, I just thought, wow, this is, um, he knows how to regulate his attention.
mm.
And when he's not in that slower deliberative mode, he is one of the fastest surgeons I've ever witnessed. I
Wow.
think he was Egyptian and had served in the army early in life and had to do these field surgeries with limited supplies and anesthesia and all of this stuff. So he had learned to be extremely fast. And so it was actually really like a tango. I mean, it was really moved along very, very fast. And then all of a sudden he would just knew when to slow down when something important was happening. Uh,
Mm,
and so, for I think, when you're on a Zen retreat in a sesshin, everything happens pretty slowly. Not much happens during the day, right? You sit for 40 minutes, you walk for 10 minutes, and then you do the same thing over and over again, for 12 times a day or whatever it is. But in life as a surgeon or as a musician or as a plumber, as whatever it is, there are things you have to kind of move quickly for and also know how to shift your attention to the things that matter the most.
mm. So really, there's power to this attending and the qualities of attending you're describing, and it seems to have multiple aspects, like knowing what's happening outside, but what's
Mm,
happening inside as well. Like this is the
right.
self-awareness that comes from. Can you speak a little bit about that, and as a physician, in terms of how these practices, the self-awareness, self-reflection, has supported you in the work that you do? Because it requires a
Yeah.
knowing and even feeling the agony and pain of someone that's
Right.
suffering,
Right.
right? Like, and um, how to
So
hold that
I
without
yeah,
collapsing
yeah,
because you see so much
right,
suffering.
right. Yeah, no, really good question. Early on, I recognized that, sometimes I would dream about patients and, wake up in the middle of the night thinking, oh, did I do this or did I do that? And so that's kind of a bit of an extreme form of
Mm,
self-awareness because you know that something about that patient is kind of getting under your skin
mm,
and affecting you. And it could be anything. It could be that it's, you're fearing failing at caring for them appropriately,
mm,
or maybe it's someone who you don't like or someone you really like. It's very non-specific. I find that, if I dream about patients, but it usually send me a signal of like, pay attention, you know,
uh-huh.
what's going on here?
Yeah.
What's the feeling? What's the body sensation? What are the thoughts going through my mind? So it's kind of a little signal. And I think that with contemplative practice and greater awareness,
Mm.
you don't need to be woken up in the middle of the night with a nightmare in order to get your attention, right? And so, and just this slight sense of discomfort, like,
Mm,
okay, I think I know what's going on, but something's telling me this might not be the whole story.
mm,
So this person is saying, well, they have chest pain, and it sounds to me like it's, chest pain from heart symptoms, but it's not really all that typical. And you know, maybe I didn't ask the right questions or look in the right places. So it kind of invites a pause. It
mm,
invites just stopping and saying, okay, I've got this sensation. I'm now going to look a little bit more carefully. I'll
mm,
listen a little more carefully. And maybe I'll hear something a little bit different this time.
mm. You mean the next time you see them?
So, or yeah, the next time
Yeah.
I see them, or even if it occurs during a visit, I'll say, can I just listen to your heart, listen to your chest once more, and just to make sure. And
Mm.
so it's kind of a signal to say, well, there's a certain incompleteness or some uncertainty there. But it's a signal that comes from within me. You know,
It's a
it's
nagging,
it's a
like this
nagging
beside, yeah,
symptom.
this is beside the knowledge of what's happening.
Right.
So you have your knowledge,
Yeah.
but there's this intuition signal that being aware of.
Yeah, it's kind of visceral for me. My stomach churns. I feel a little, maybe a slight tremor. It's kind of, I've become attuned to those things of that there are
Mm,
symptoms that something isn't quite right. So sometimes that signal pans out and really I find something new, and sometimes it doesn't. But it's coming from within. And also on a psychological level, am I trying too hard to please this patient? You
mm,
know, do I want to be liked by this person?
mm,
Does that make our relationship better or does it get in the way?
mm.
So on the psychological level as well. And also just simple tropisms, is there an aversion? Do I move my chair back whenever I see this person sitting?
Ah, yeah. So kind
Do
of,
I
yes.
feel a need for distance? And not that it's good or bad. Sometimes distance is good. If someone's very agitated, sometimes taking a step back will help them feel calmer.
Yeah, yeah, yeah.
And
Mm,
so so it's not that these actions or sensations are necessarily good or bad, but they're really signals in the same way that
mm,
if someone's skin is yellow, I will use that as a signal to look for liver problems. Or,
mm.
if I notice that they have a particular kind of tremor, I'll do other, so there's the same, it's another form of information that's
Right.
useful to me. And the other, I think there's a deeper part because I think that medicine is largely about communication. It's
Mm,
about patients finding a language to communicate what's important to them,
mhm.
and me finding the language to the ability to listen and understand, and then reflect back to them that they've been understood and that I might in some ways be of help.
Mm,
So I think that awareness breeds a kind of reciprocity, a kind of what some
mm,
people have called epistemic reciprocity. That
mm,
is that there's my knowledge of the patient, there's the patient's knowledge of themselves,
Mm.
There's the patient's knowledge of me, and there's my knowledge of myself.
Mm.
And all four of those are interacting in a very dynamic way as I provide care for this individual who's come to me for some reason or another, which could be really anything. It could just be, they could be lonely. They could be
Yeah.
having pain. They could have
Yeah.
a heartache. Um, they could be coming because their spouse has been nagging them to come. I mean,
Yes.
all of those reasons. So,
This takes us to, you speak about that in the book, and it's really a key element in mindfulness practice is a sense of beginner's mind and curiosity. So suspending some of our judgments of what we think is happening. So how do you balance that? Here you are an expert in what you do, and having to take a beginner's mind with curiosity as you meet someone. Like that's a beautiful way of being with. There is balancing that expertise, but also meeting with freshness who's in front of you.
yeah, no, I think when I'm with trainees, medical students or residents, I often emphasize that they shouldn't be limited by their expertise.
Mm.
And that limitation goes two ways. One is you can be limited because you don't know enough or you haven't had enough experience. But you can also be limited because you have had a lot of experience. So I'll give you an example. I took care of a lot of patients with diabetes. And diabetes is a really hard disease to adjust to because to control it and have the best outcomes, you have to really limit your diet quite significantly and
Mm.
take medications that don't always make you feel good.
Right.
And sometimes people feel better when their blood sugar is high. And
Mm.
when you lower it to a more normal level, they don't feel quite as good, at least for a
Mm.
while. And the majority of people with diabetes do not keep to their diet as prescribed and don't take their medications as
Mm.
prescribed. And it's understandable.
Challenging. Yeah.
Right. So in medicine, we would call those patients non-adherent or non-compliant.
Mm.
But if you take a beginner's mind and ask the question, and often we don't really ask questions about it. We just say, oh, you need to exercise more. You need to
Yeah.
use this diet. You need to take
Just
this
do it
medicine.
type of thing. Yeah.
Just
Yeah.
do it. Right. Just do it. Right. And then we feel kind of, self-validating and good about ourselves, but patients don't improve. Right. So it becomes this frustrating cycle. And so I found at a certain point, it kind of dawned on me to say, it sounds like you're having trouble taking your medications. Can you tell me why?
Mm.
Why that's so hard? I'm trying to understand. And everyone has a different answer. It's
Mm.
maybe I just don't like this pill, maybe it's too big to swallow, or maybe it's expensive and my insurance doesn't pay for it, or maybe I'm supposed to take it in the morning, but I'm so busy in the morning getting the kids out to school that often I forget. And so my expertise in a way, just saying this is someone who needs to do X, Y, Z, can get in the way of being more creative, and that curiosity and beginner's mind of saying, well, I know a lot about diabetes, but I don't know a real lot about this person's life. And it
Yeah.
sounds like this person's life is something important for me to find out about. So then they become the expert because they're instructing me about their life and what works and what doesn't and the stresses that they have. And
Mm.
so the tables get turned and I become the student and they're the teacher.
Mm.
Okay. This is hard for experts to do,
Yeah.
right?
Uncomfortable, right? It can
Yeah,
be
right.
uncomfortable to
Right. And it
to
can also, make you rethink what you're suggesting. And it's easy to be curious when you're, at the edge of the Grand Canyon, right? You're in this awesome place. It's unlike any other place in the world. You are totally awestruck and you just want to see and find out everything about your environment. But if you're rushed or angry or offended in some way, or if it's just disgusting, I mean, some patients come into the emergency room
Mm.
smelling really bad.
Yeah.
It's an aversive environment. I mean, it's hard to open your mind to be curious and open your awareness when all the stimuli coming in are pretty noxious. But
Mm.
that's the important piece, is to develop the capacity for curiosity when you're experiencing that kind of negativity.
Mm.
So when someone's screaming at you, which
Mm.
does happen to me as a doctor periodically, more often than I'd like. It's saying, it's just stopping and saying, wow, I'm really wondering about what's going on with this person or about this situation, or if there might be another creative way to view what's going on. I mean, all those natural reactions that we can easily adopt when we're feeling calm and good about ourselves, when we're feeling
Mm,
threatened. So again, that's part of, I think, what contemplative practices and self-awareness can teach us, is to harbor those negative feelings without trying to push them away,
mm,
and also applying a certain amount of curiosity.
yeah. So really allowing space in our hearts and our body and our minds for some of that pain that we can experience in being with others. So that there's
And also
which is
knowing how to be appropriately self-protective.
of
So
course.
yeah,
It's not like being a martyr.
right,
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 right. But
right,
there's something I want to
right,
link to. You mentioned this in
right.
your book as well, is empathy versus compassion, and how these contemplative practices of compassion have supported you and supported physicians compared to just empathy. Can you say a little bit about that? The how do we meet suffering with compassion without getting lost in it?
Um, that could be another like 3-hour talk, because in the book, well, first of all, let me just tell you how I went about all this. Because there's this debate that empathy involves emotional resonance, and compassion involves using that emotional resonance to
Mm,
uh, do something pro-social to help someone else, and that pro-social act, um, in a way, detoxifies the pain that we can feel with just empathic resonance. So I think that empathy, and I'm not the first to say this, comes in many, many flavors.
mm,
And in speaking with empathy researchers, including those who are oriented towards contemplative practice, like Tanya Singer and Olga Klimecki and others, at the Max Planck Institute, they're often talking about the emotional resonance part that can get you into
mm,
trouble. That if that emotional resonance is not controlled in some way, and in a way framed and contextualized and used to drive greater understanding and greater pro-social behavior, then it can actually cause quite a lot of distress. And it has
mm,
happened to every clinician. I
mhm,
remember as a resident taking care of someone who was about my age,
mm,
who kind of looked a little like me,
mm,
who was in the ICU, very, very seriously ill with a lung infection and might not live. And this was one of these people that I woke up at night dreaming about, because
mm,
and then I realized, wait a second, what's going on here? And I'm confusing who I am with who he is. I'm
mm,
seeing myself in that bed, or vulnerable to being in that situation, which
mm,
is totally understandable. But my reaction to it was not very healthy to me nor to him.
mm,
Um, so that uncontrolled emotional resonance is something that can another cause of distress. And so as clinicians, we need to find ways of being empathically attuned and present and understanding someone else's situation, but also having enough differentiation between who I am and who that person is, in order to actually to be truly compassionate to that person,
mm,
rather than just well, alternatives to that. So I also think that there's a limit for most of us to compassion, that we need rest. We need sometimes to distance a bit, and that's okay,
mm,
as long as we know that we're doing that.
mhm.
And
From distance from like taking
from
time
from
off,
the
you mean, or
suffering, from the
suffering?
suffering,
Yeah.
and from the emotional resonance, just to regain our own balance and our own bearings.
Mm,
So I'm not of the school that taking in everyone's suffering all of the time is necessarily healthy. And
mm,
there I might disagree, or others might disagree with me. But
mm,
at least in the context of being a physician and doing the day-to-day work that we do, I think that we need to be intelligent in the way that we experience and use compassion, and also know when we need to take a brief retreat before re-entering again.
mm. And I guess that's the challenge with the pressures, like time pressures and financial pressures. And if someone is not able to take that time, I guess that's when burnout start building up.
Exactly, exactly. So I think that environmental, I just can imagine myself
Mm,
um, being in a situation that, for example, doctors in Gaza find themselves right now.
mm,
Like how do you take in all of that suffering and the lack of resources to do anything about it? Or in Somalia, or in South Sudan, or in Myanmar, or you can name a gazillion places where doctors might be in that position, and by necessity have to disconnect, not in ways that are hurtful or projective or harmful, intentionally harmful, but in ways to ensure one's own sustainability.
yeah, of course. That's part of like self-preservation and balanced as well. I hear you describe that as well in your talks in your book is like allowing ourselves not just being shielded from it, but allowing
Mm.
ourselves to feel it and to feel that pain and to feel like, if a patient passes away, like feel that grief, that loss, allowing ourselves to feel that, including mistakes that happen. And
Yeah,
actually, I want to read something from your book as well about like working with errors, working with setbacks, because that's part of resilience and thriving. How do we work with that? So I'm just going to read this quote. There's so many beautiful, powerful statements and paragraphs in your book, but I'm just going to share one more for today around that. So you speak about working with setbacks as how fearlessness is required to look at our failures in the eye. It means recognizing the fault lines, allowing ourselves to fall apart just a little, to feel the pain of failure, but not so much that we become ineffective or overwhelmed. I love that. Like just allowing ourselves just a little bit feel that falling apart, but not just getting lost in our own misery and suffering, but just feeling it. So can you say
yeah.
a little about that? I thought that was really so beautifully said.
I think that part of maybe maturation or contemplative practice, I can't really say what it is, but I think that ability to allow oneself to, well, I'll just speak for myself, to allow myself
Mm.
to, I guess it's just part of being human, just saying that we are constantly in a very physical, psychological, and maybe spiritual way are constantly experiencing wounds of some sort or another and repairing them. I mean, that's what the body does. We're
Yes.
constantly, internally and externally, we're shedding layers of skin, blood vessels are regenerating, brain cells are disconnecting and reconnecting. So this is a process of falling apart and coming together that's part of who we are as physical beings. And psychologically, every time there's a wound, there's some healing and sometimes scar formation and sometimes transformation. It's just who we are as humans. And I think that just that recognition is really central. I do want to take a slight tangent here and talk about something that I read since the book was published. There's a book about George Orwell,
Mm.
and the writer of 1984 and Animal Farm, and who actually fought in the Spanish Civil War on the democratic, not fascist side, and risked his life actually, and was involved in all of these social justice movements, and also, if you read his works, had articulated a pretty dark vision of the world. He had a rose garden that he tended quite carefully, and whenever he returned to his house in England, would buy more roses and plant them. And apparently, the rose garden thrived long after he had died.
Mm.
And this book by Rebecca Solnit talks about how in life one needs to have a mission, which is often difficult and unpleasant, and also needs we need physical nutrients like bread and water, but we also need roses. Um, and and for me, bruises come in the form of playing music. I'm a musician. Come in the form of being with family. For me, being in nature. There are a number of ways in which
Mm.
bruises kind of manifest themselves. So for me, that was an important lesson, is that sometimes that, not withdrawal, but counterbalancing the distress and suffering that we see, is also the ability to cultivate the ability to appreciate beauty wherever it resides.
Mm.
So one exercise I give to people in workshops that we do is to make a commitment every day to have one moment of exquisite beauty. And you never know when that moment's going to happen, right? There's no way of predicting. And maybe it's just looking at a face or something in nature, or a building that's particularly appealing to you. Just it could be anything. Um, but just recognizing that in every day that you can, and it's available to you, to have that moment of exquisite beauty. And so I've made a practice of doing that in the hospital.
Mm.
Hospitals are not ordinarily terribly beautiful places.
Mm.
But there are always these opportunities to find one brief moment of exquisite beauty, and often many, but it's just starting with one.
What a beautiful assignment if anyone is interested in trying it out, is looking for a moment of this beauty, a moment in the day. How beautiful. And I think that's also part of your workshops in terms of on your resilience and working of resilience. And I know we're just reaching the end. There's so much more actually I'm interested in asking you, so maybe we can have a round two down the
Okay, okay.
line. Because I'm very
With
interested in
pleasure. Yeah.
interested in resilience and building resilience. So I'm wondering, anything else you're wanting to share before we end? I know you do have to leave, so I just want to be respectful of your time. Anything else you want to let?
Yeah, I mean, I'm happy to be in touch with people who are listening and people who might want to attend a workshop. And I do have a website. It's just my name, ronaldepstein.com. So feel free to be in touch. And our mindful practice programs also have a website. So, um, just an invitation, because the reason I'm doing this podcast, and I've done other podcasts,
Mm,
is to engage in dialogue, not just with you, but
mm,
potentially with people who might be tuning in and uh, you know listening. So I
mm.
think that's really part of what makes our lives richer. So
Yeah.
thank you for the opportunity.
Thank you. True pleasure having you. And may this lead to many dialogues and creating supporting change. So thank you for joining us today. And I also want to thank the listeners and viewers for being here. Hope you found this useful. If you did, feel free to share, like, and subscribe. May your moments be filled with ease and may you be present in as many of them. Thank you.